First, I'm Michael Alatriste,
Sure.
and I've been practicing for just under 20 years. Last year, a surgeon that I know, Gurusamy Manokaran, who you may or may not have heard of, but he's really one of the most globally renowned lymphedema surgeons. I had met him 15 years ago, and he called and said, would you come to India to instruct our therapists? And he said it's going to be at the Amrita Institute of Medical Sciences. I also want to say at this point that there are 46 million confirmed cases of lymphedema, filarial lymphedema in India, and no centers, no therapists that are treating this. The issue was that there was a dire need for therapeutic intervention for this population of patients, and there simply was nobody to do it. Although there are quite impressive surgical trends that have emerged over the past, let's say, decade, still, as Manokaran would say, the mainstay of this, the gold standard, is still combined decongestive therapy, the conservative treatment of lymphedema. So with that in mind, he really wanted me to focus on the conservative therapeutic treatment of lymphedema, not necessarily what therapists should do preoperatively and postoperatively. For instance, in the case of lymph node transfer or lymphaticovenous anastomosis, but this was really for the very pure conservative applications, compression bandaging, manual lymph drainage, compression garments, introducing that. And he would tell all of the surgeons in the hospital, Michael is here to teach our therapist MLD. And I said, Manokaran, it's not just MLD, it's combined decongestive therapy. Your bandaging is what's really going to give the results that you're looking for. But we literally took these suitcases, I think we had 8 suitcases with our own, shipping them from New York to London to another stop and then to India. The donations were absolutely crucial because without them we could not have instructed the therapists in proper bandaging. Right. They were using long stretch bandages, they were using bandages we had never really seen before, and yet they were getting results, but we knew that they were not optimizing their patients. We saw immediately that as soon as they started applying the bandages, patients that they had had for months were now getting results in a matter of days that they couldn't achieve before. So even the therapists were saying, we couldn't have done it without this. In fact, when the doctors and surgeons walked in and saw all of the supplies on the table, they just stopped for a moment because they couldn't believe that somebody, some company, entity that they didn't know, rose to the occasion and brought these here. At that point, I threw out the curriculum. I let go of all of my PowerPoints, all of my didactics, and I decided to make this completely a bedside training. So that's how we did the course. And every day, there were so many patients that we never stopped, and more were waiting outside. So once they heard that this person from America came, and we were starting this clinic, literally we had lines out the door. And what was the most unique issue is that patients would stay for hours. I mean, sometimes I think there were 1 or 2 people that waited 5 hours for us because, we just had no opportunity. And when we went to see them, they put their hands together and thanked us. Like, it was unbelievable. So the humility, the gratitude that we experienced there was unbelievable. Kochi is a remarkable boy. He is 7 years old, I believe. He had primary lymphedema, basically. So it wasn't filarial, but we also want to look at this young population, this pediatric population, because if his condition is not checked because of the heat, where it could be 100 degrees on average there from, let's say, April through September, if not beyond, in the high 90s to hundreds, even higher, the doctors are focused on optimizing him right now at this age, so that as he grows, he will have a normal life. And I just want to say this too, sometimes lymphedema is a stigma in India. So basically, that boy who has lymphedema may not be eligible for marriage because of that. Because a lot of marriages are still arranged, and they see it as kind of a stigma, a challenge, and they may not want their daughters marrying into, this type of situation. So it's much more serious, perhaps, than it is here. So when we look at Kochi, we're looking at not only addressing his immediate clinical needs, but also thinking about his evolution into adulthood. We have to look over the next year or two to actually, and really monitor him very closely to see exactly what the benefits of these procedures are. With that said, we will continue to treat him with conservative measures as well.
Okay, great.
Muhammad also had primary lymphedema bilaterally, but his was a little bit more intractable. His, he's a little bit older than Kochi. I believe he also had slight autism, a sweet, wonderful, lovely child, but basically both legs from the knee down, your classic primary lymphedema with indurated tissue on the dorsum of the feet. So he was really kind of trending towards a more truly intractable condition that was going to exacerbate rather than improve. But we decided that we would keep him in conservative treatment and attempt compression garments for him in maintenance. And we did that with Kochi as well. The access to treatment is minimal, almost non-existent. So, when you look at India at large, and you have, let's say, 100% of cases that need to be treated, you have maybe 1%, a percentage of 1%, clinicians that are able to do this. So that's where we stand. And we're talking about really a revolution here in healthcare in an entire country, which is a remarkable thing in my estimation. But I think everybody unanimously truly would agree that it was the BSN donation that made this possible, that made it successful. So here we are with the clinical staff at the Amrita Institute of Medical Sciences. These are all the clinicians. We have some therapists that are specifically treating lymphedema. We also have surgical techs. We have a very wonderful assortment of individuals that are extremely committed to helping this patient population here. So we have had about a week of training, and we're here to just evaluate the remaining supplies. We truly all want to thank BSN for this amazing contribution, because honestly, without this, we would not have seen the results that we've seen. But what does it mean to you to have had these supplies, to have had patients, and to have been able to treat patients with the proper supplies? What would you say to the company?
Oh, it's like working pleasure. You get real pleasure working with all these bandages. It's like we got something it's easy to work. Like rather than using those and no difference, we felt it's a pleasure. Like we felt the pleasure in working with these. And when we heard these are so expensive, and they are really affording. I mean, they're giving to us with the so expensive bandages. Like it's really helpful for us.
So we want to thank you all so much at BSN for what you've done. This has been a wonderful opportunity, a great experience, and we are truly, truly thankful. And we say that with absolute humility. This has really been an extraordinary experience based upon and thanks to your generosity. So here we have it. Thank you.
Thank you.
We have already had approximately 12 patients in this few days that have come in, and there are many more waiting outside, actually, that are just hopeful that at some point they will also have access to the same level of treatment. With that said, the patients we have already treated, although they've had really great results, may not be able to sustain them because we simply don't have enough supplies. We're hopeful that in the future we will have perhaps BSN once again donate these supplies so that many more people here could get the help that they need. What I would like to do is work with, for instance, your company, BSN, to see what we can do about, not only donating more supplies, which you have graciously done again for my return trip in March, at the end of March this month, but also see if we can create a market there where they will have access to these supplies and they can actually be self-sustained in that way. I would say it's not so dissimilar. I think that we have a population of patients here that are just as refugeed as they are in any other part of underdeveloped part of the world. We turn away, I would say, 60 to 70% of all of the calls that come into our practice because patients cannot afford to pay for treatment. I would say that we are more alike, the United States and India, than most people would imagine.
Wow.
We just have different things at our disposal.